The Ghana Health is targeting children born from January 2016 to February 2018 in a special exercise to prevent all polio diseases. After 16 poliomyelitis cases were recorded in the country last year, the latest case of polio was recorded in the Ashanti region last month, prompting a nationwide exercise which has started today. Head of Public Health of Ghana Health Service, Dr. Bedusa Kodie, says the exercise has become necessary following the detection of those positive cases in the country. He also says that initial finding into the 16 cases recorded last year revealed that 14 of the children who were infected missed out on the routine polio vaccination. The exercise is targeting 2 million children in the country.
So samples were found, and later we now had begun to get cases in Ghana of the CVD-PV2. And since this outbreak, as was mentioned, 16 cases have go into the details, as Dr. Sarkodie has explained a lot of the efforts that and the steps that the government has taken in collaboration with Global Polio Eradication Initiative partners. So various rounds have been conducted, and the partners have been working closely with the ministry in the various campaigns and also in enhancing polio surveillance. We've had the WHO, CDC, UNICEF staff out there on the field working in collaboration with government, health workers and officials towards addressing the outbreak. Together, we, the JP partners, remain resolute in our fight against polio. On behalf of the JP partners, I want to congratulate the ministry and Ghana Health Service for their leadership in the response, and also appreciate our gallant health workers who come through communities, including the hardest reach areas, to get every child vaccinated. Our community-based volunteers who have been supportive since we started the fight against polio, community leaders for their leadership and support, and ultimately to parents and caregivers for availing their children to be vaccinated.
Apologies, that was rather Country Director for WHO, Nima Kimambo, there speaking. You hear from, and what she's saying is that according to the Ghana Health Service, the emergence of vaccine-derived polio viruses is not as a result of the vaccine itself, but only occurs when there is low vaccination coverage over long periods, which are compounded by poor sanitary conditions. So that was the point that you had Dr. Nima Kimambo make there. We can now go back and listen to Dr. Bedusa Kodie on this nationwide exercise.
Out of the 16 regions, we have confirmed the polio in about 4 of them. All the isolated viruses are similar to the virus that was isolated from surveillance in Nigeria during the initial CVD-PV outbreak in 2018 in Nigeria. Following the initial case and events, the Ministry of Health, Ghana Health Service, declared the situation public health emergencies for national concern and consequently put some measures in place, and a series of emergency measures were put in place by the Ministry of Health, Ghana Health Service and partners. I've mentioned CDC, I've mentioned World Health Organization, Rotary International, UNICEF, and all these good partners are working closely with the government of Ghana to address the challenge that we have as a country in respect with the polio outbreak, the polio type 2, CVD-PV type 2. Distinguished ladies and gentlemen, permit me to highlight some of the measures that we have put in place in response to this outbreak in the country. We, as a health sector, have conducted, working with partners, we have conducted detailed investigation in all the events. We rapidly deployed multidisciplinary, multi-sectoral national team to support the affected regions and districts in responding to the outbreak. Public health emergency management structures at all levels, the national level, the regions, and the districts, have all been activated and are still active. We've been conducted public education at national, regional, and districts to inform the general population, and we wish to thank the media for your support in this crusade, and having sustained this to now, we are in this together until it's over. We've been strengthening surveillance on polio in humans and the environment at all levels, national, regions, and districts. We've done cross-border meetings and other collaborative activities with our neighbor countries across the borders. And we have held meetings with Togo and Cote d'Ivoire. We mapped out districts and regions and executed outbreak response vaccination campaigns in 10 out of the 16 regions using the type 2 oral polio vaccine. And the last of this vaccination campaign ended a few days ago, which was the 8th of this month. We are here today to brief you on the upcoming nationwide campaign using the inactivated polio vaccine, which is in the form of injection. Starting today, 19th of February 2020, and ending on the 25th of February 2020. We plan to cover all children, the birth cohort from 1st January 2016 to all children born 2017 up to the end of February 2018. We need to get this very right, because these are children most at risk of getting the polio type 2 outbreaks, and for that matter, getting paralyzed. Parents and guardians, caregivers of children in this age group, let's take good note so that you bring these children to the various vaccination points for the needed vaccination to be given.